Around the world, obesity is a growing problem. Diets are becoming increasingly unhealthy, even in countries where poverty is widespread. The major food companies are targeting developing nations. They make huge profits marketing processed food as healthy.
When children see commercials for these foods, they want to have them, so we end up buying them. Sandwich cookies and so on. Kids want them. We buy sweetened dairy products even though we know they're bad for us. We succumb to a manipulative advertising industry.
It's not as though all traditional Brazilian foods are healthy either. Brigadeiros are chocolate truffles. A bit of chocolate now and then is, of course, harmless. Too much, on the other hand, is a health risk. In Brazil, 30% of children between 5 and 9 are obese. Diabetes is widespread. 210 million people live in Brazil. Fast food is ubiquitous and cheap. Even people in the favelas can afford it, and multinationals like Nestlé, Coca-Cola, PepsiCo, Unilever, and Danone are making the most of these markets. But the processed foods they sell to poor communities exacerbate the problems of obesity and diabetes. It's a development that Carlos Monteiro has been observing for some time. A professor of nutrition and public health at the University of Sao Paulo, he's also a member of the WHO Nutrition Expert Advisory Group.
But the problem is that the products, what we call ultra-processed products, they are increasingly being consumed by Brazilians. So then in the last 20 years, the proportion of calories that come from these products, they double. So then what we project is that if we don't do anything, in a few years, the situation will be much worse in terms of the diet.
Of Brazil's population of 210 million, 40 million are overweight. 14 million suffer from diet-related diabetes. The government is now taking action. In this health center, nutritionist Aline Brandão and her team have a patient base of 30,000. Many of those people are uneducated and know next to nothing about healthy eating. She advises her patients and also pays home visits to raise awareness among members of the community who don't visit the health center.
We want to make natural foods more readily available than processed foods. That's our biggest challenge. Many mothers in this area go to work and don't have much time, so they often give their families ready-made meals. That's a common problem.
The nutritionist's patients include Maria da Silva and her family. She's a cleaner, and her husband took early retirement. Maria, her daughter, and her grandchild are all overweight. They don't eat a healthy diet. But now, their eating habits are starting to improve. The contents of their kitchen cupboard are typical for poor families in Brazil.
All of these products have a high sugar content. People have adopted this diet. That's what they eat instead of proper meals. But these products are not only unhealthy, they're actually comparatively expensive.
Despite their dirt-cheap ingredients, sugar, salt, fat, and carbs. But in the favelas, there are few alternatives. Big supermarkets that stock fruit and vegetables are a long way away. Small neighborhood stores like this one don't sell much fresh produce. 25% of food consumed in Brazil is industrially processed. Unhealthy fast food is a global problem and not one restricted to developing countries. Today, 641 million people on the planet are overweight, a six-fold increase in the last 40 years.